As we continue our conversation on sexual dysfunction today, we're focusing our attention on the role of interest and desire and how they can impact overall sexual well-being. Joining me in studio once again is Dr. Mark Opperman from the T Clinic. So Mark, let's start with what interest and desire actually are in the context of sexual function.
Michael, I actually think it's all in the name. It's a lack of interest in sexual activity. Now, this can be something that's always been there, or this can be something that's developed over time, and there's different causes. It's slightly different to complete apathy when it comes to sexual relations.
Right.
But it's a big warning sign.
Okay.
What I think is really important to understand is, although we have different types of sexual dysfunction, from libido and then arousal disorders and pain disorders and things like that, all of them can link back or cause an interest and desire or lack of libido and sex drive.
Okay, so it's almost an avoidance that might occur based on another condition.
Yeah.
So what would be the signs that somebody is experiencing a sexual desire challenge or disorder?
Michael, I think it's when you are in a healthy relationship and things start changing when it comes to feeling the desire or interest to have any kind of sexual relations with your partner for no reason.
Okay.
So I have to classify that, because one of the common causative factors can be problems in a relationship. But there's also others. We need to take a look at psychological factors.
Right.
Stress probably being the biggest one. And as we all know, stress can lead to anxiety and depression.
Yes.
And that will diminish your sexual interest. But there's also other causes that can lead to that.
So Mark, you mentioned the psychological aspect, the depression aspect, anxiety, but now, so is it always a psychological challenge, or is there also a physical aspect to this interest disorder?
Michael, I don't want to say that it's always psychological, and I don't want to say it's necessarily physical.
Okay.
For instance, physical conditions that can lead to a lack of sexual desire can be something that causes you pain during sexual encounters. So it's not enjoyable, it's uncomfortable, so I don't want to do this. So your interest will diminish.
Okay.
But I think what usually happens is a type of sexual dysfunction in one partner often leads to a low libido in the other partner.
Okay.
And again, that's why it's so incredibly important that we talk about this openly to each other and to healthcare professionals, and because we can remedy this situation. Some of the causes of sexual dysfunction or interest and desire dysfunction that really plays a role here is hormonal disturbances. Now, for both men and women, testosterone, estrogen, progesterone all play a role. And as we get older, those hormone levels start to decline, and it can lead to a lower libido. We see this often in postmenopausal women just who are pregnant or just after pregnancy. It's a natural response for them. As men grow older, the libido might start dropping. But then there's also other psychological factors. And here we can look at previous sexual experiences, especially sexual abuse and sexual trauma.
I can imagine.
That can lead to that. But you know what? Certain medications that we use for common conditions like depression and anxiety can also lead to this. So it's a complex thing. It's not, as we said in the first episode, for someone with a lack of libido, you can't just give them a little blue pill. It's not going to change the situation.
Yeah.
And I think it's something that can be very effectively addressed through lifestyle changes. When it comes to managing your stress, getting good sleep, increasing your physical exercise, where you start feeling better about yourself. But the biggest one, again, is speak to your partner. We often treat lack of libido with psychotherapy, cognitive behavioral therapy, sexual counseling, etc., etc.
Right.
If it is a problem for you, I think one of the bigger problems that I face in my practice is when one partner has a high libido and the other one does not. So you can't just say, okay, elevate someone else's libido if it's naturally their state of mind. So communication around this topic is really important.
So now, taking that communication between the partners, now bringing in a practitioner, how do you perform a diagnosis of this kind of condition?
What I do in my practice is we go through a full consultation where you take a look at what has happened in the medical history, what is the current medical conditions, and specifically what are the medications that the patient is taking. What was previous lifestyle factors that could have played a role? Was there any kind of substance use? Because it's often a problem for people. And then physical conditions. What is happening with your cardiovascular system? What is happening with the prostate? Hormone levels. Is there a decline in testosterone or estrogen? Is it just a normal age thing? And then, you going through that, taking a look at the medications that the patients are taking, optimizing lifestyle, optimizing the things that can be optimized. And if that doesn't give you a result, it's, okay, what is wrong in the relationship?
Okay. So Mark, if you had to give some people some advice, somebody who might be looking at this and thinking, oh, hang on, I think I recognize myself in that. What would be the first steps to take to engage in this? Because it's scary for a lot of people. It's not something they like to talk about. It's not something that people usually do talk about. So how do you get them on a path that's going to get them where they need to be?
Michael, I think the first one is to actually do some introspection. Take a look at yourself. Are you happy in your relationship? Are you still attracted to your partner? And if you are not, you have to have that conversation. Spice things up a little bit, do things slightly out of your comfort zone. And this can be one of the causes, is one person has certain fantasies that the other partner is not interested in, and then there's a disconnect. Lifestyle, stop smoking, stop alcohol use, stop the recreational drugs, please. And then, I would say sleep, manage stress, become physically active, really important. And if you do not see a change, reach out to a medical practitioner. Take a look at your hormone levels, see what's happening there, see if all your cofactors, iron, vitamin D, those kind of things are there. And usually, any kind of sexual dysfunction is a sign of underlying conditions that you might be missing. Might just be depression and anxiety that you don't realize, or it can be something more serious like kidney problems, liver problems, diabetes, etc.
Okay. Mark, remind us once again, if people want to get hold of you, how can they find you?
The easiest is to get hold of us at 010-824-1393. Otherwise, we are on all the social media platforms, and our website is www.viteclinic.com.
Great stuff. Mark, thank you so much. Always interesting having this conversation with you.